Hello and welcome to ERPM Note Log. Today I will be teaching you about hernia. Hernia is the abnormal protrusion of an organ or part of an organ through an opening which is artificial or natural with a sac covering it. The commonest form of hernia is inguinal hernia. This is due to the presence of naturally weak areas like the deep ring and cord structures. Indirect is more common. The other common hernias are incisional, femoral, epigastric, and umbilical. There are certain types of rare hernias as well, such as obturator hernia, Spigelian hernia, lumbar hernia, and gluteal hernia. There are three parts of a hernia: the covering, the sac, and the content. The covering is the layers of the abdominal wall through which the sac passes. Sac is a diverticulum of peritoneum. The sac consists of neck, which is narrow in indirect and wide in direct, a body, and fundus. And now I will draw a diagram which will illustrate the various parts of the sac. The sac consists of omentum, which is known as omentocele, intestine, which is commonly small bowel but even large bowel can herniate, a bladder, which is known as the cystocele, ovary, which herniates usually along with the fallopian tube, appendix, which is known as Amyans hernia. Now I will be drawing a diagram to illustrate the difference between an indirect sac and a direct sac. In an indirect sac, the sac starts lateral to the inferior epigastric artery, whereas in the direct sac, the sac will be seen medial to the inferior epigastric artery. Now, I will teach you the classification of hernia. Hernia is clinically classified as reducible, irreducible, strangulated, obstructed, and incarcerated hernia. I will explain each of these in detail. Reducible hernia can be reduced by the patient or surgeon, or it reduces on its own. The intestine reduces with a gurgling sound, and it's difficult to reduce the first portion. Omentum feels doughy, and it's difficult to reduce the last portion. Irreducible hernia. All or part of the contents of this hernia cannot be reduced. This type of hernia has a high risk of strangulation. The causes of irreducible hernia are narrow neck, overcrowding, and adhesions. Strangulated hernia is an irreducible hernia with compromise of the blood supply. This is the most serious complication of hernia. The clinical features of strangulated hernia is a swelling which is tense, tender, and there will be no cough impulse. Features of intestinal obstruction can be observed. However, in Rectus hernia, the features of intestinal obstruction may not be observed. A Rectus hernia is protrusion of only part of the circumference of antimesenteric border of the intestine. I will draw a diagram to explain it further. As you can see, only the antimesenteric part of the intestine has herniated, whereas the mesenteric side is normal. Strangulated hernias commonly occur in indirect inguinal hernia. The highest rate of occurrence is in femoral hernia. Incarcerated hernia. The contents of the hernia are functioning normally but are imprisoned within the sac by adhesions. Always remember that there are three cardinal features of a hernia: reducibility, defect, and the expansile cough impulse. The etiology of hernia. There is evidence that hernia occurs due to an inherited imbalance in types of collagen. For example, conditions like Marfan syndrome and Ehlers-Danlos syndromes. Smoking causes defective connective tissue metabolism, so hernias are common in smokers. Hernias are more common in pregnancy due to the laxity of pelvic ligaments due to hormones. Hernias are common in the elderly because of degenerative weakness of muscle and fibrous tissue. High abdominal pressure due to constipation, prosthetic symptoms, coughing excessively due to respiratory diseases, obesity, etc. is not a major cause of hernia. Now I will enumerate hernias occurring in adults in decreasing order of frequency. Inguinal, paraumbilical, incisional, femoral, and epigastric. Umbilical hernia is common in children. Thank you for listening to my video. If you like this video, please like and subscribe. If you want a typed PDF note of this lesson, please contact me.